Good afternoon, Chairman.
Good afternoon and welcome to the virtual meeting of the Lincolnshire Health and Wellbeing Board. My name is Councillor Sue Woolley, for those of you that don't know me, and I'm chairman of this board. I'd like to welcome all members and officers in attendance today. The audio feed of this meeting is being broadcast via the County Council's website, and I would also like to welcome the members of the press and public who are listening to our meeting online today. Anyone invited to speak during today's meeting should unmute their microphone and switch on their cameras. Please turn off your camera and microphone when not participating. If you wish to speak, please use the chat function and type "speak" as a comment. All officers and members are welcome to use the chat function. Requests to speak will be collated by Alison and will then be passed on to me. She'll either do it discreetly, or if I take no notice, she'll shout very loudly at me. It's my intention, wherever possible, that decisions are reached by consensus. It's in exceptional circumstances where decisions cannot be reached by consensus of opinion, voting will take place, and decisions agreed by a simple majority. If you do experience any IT issues during the meeting, please end the call using the red phone icon and rejoin the meeting using the link previously provided. If you do experience connectivity issues while speaking, please turn off your camera, as this may help. If you continue to experience IT issues, please contact Simon Firth, IT engineer, for assistance. Can I also ask that members who are intending leaving the meeting or returning, just indicate so in the chat function. Officers don't need to do so. Katrina, can we now have confirm attendance, please, for the members, officers and guests present?
Thank you, Chairman. Good afternoon, members. Could I please ask you to confirm your presence when your name is called? Councillor Patricia Bradwell.
Present.
Councillor Mrs. Wendy Bokit.
Present.
Councillor Rob Kendrick.
Present.
Rob Kendrick was present, was he?
Yes, present indeed.
Thank you. Councillor Ron, Hugo Marfleet's going to be late, Chairman. Councillor Ron Oxby.
Present.
Councillor Nigel Pepper.
Present.
Councillor Mrs. Sue Woolley.
Present.
Councillor Nick Worth.
Present.
Ben Garrett.
Present.
Thank you. Janice Spencer.
Present.
Derek Ward.
Present.
John Turner.
Present.
Councillor Donald Namstead.
Sorry, present.
Thank you. Mark Jones.
Present.
Thank you. Mike Hill. Are you there, Mike?
You're on mute, Mike.
Present.
Thank you. Jason Harwin.
Unfortunately, Chair, Jason Harwin can't be here this afternoon, so you have the understudy, the Chief Constable, instead.
Okay, and who are you, please? Sorry.
Honoured Bill, thank you for joining.
Bill Skelly. Okay, thank you very much. Thank you. We also have the following officers present today. We have Alison Christie, Programme Manager, Strategy and Development in Public Health. Sam Neal, Assistant Director, Prevention and Early Intervention Public Health. We have the following guests in attendance today: Sarah Stringer, Transformation Manager, East Locality; Kirsten Redmile, STP Lead Change Manager for Personalisation; and Dr. Sunhil Hindosha, Clinical Director of Marina Primary Care Network and Chair of the Lincolnshire PCN Alliance. We also have observing the meeting today Janet Inman, Non-Executive Director of NHS Lincolnshire CCG, Councillor Stephen Craddock from Walsall Council, and Amy Thomas, Programme Manager for the Centre for Ageing Better Partnership. Thank you, Chairman.
Thank you, Katrina. Can I just remind everybody about their microphones, because somebody was wriggling in the background and it was quite noisy. Thank you for that. I'm not sure at the moment, for those of you that might be wondering who on earth Councillor Stephen Craddock is from Walsall Council, he asked if he could, he's there.
I'm here.
Hello, Stephen. Councillor Craddock is a new member to our Health and Wellbeing Board and asked if he could observe our Health and Wellbeing Board. So I hope you will all give him a warm welcome. Thank you very much.
Thank you, Councillor.
Okay, moving on to apologies then, Katrina.
Thank you, Chairman. We have received apologies from Heather Sandy, Executive Director of Children's Services, but we have Janice Spencer, Assistant Director of Safeguarding here today in Heather's place. We also have had apologies from Elaine Bayliss from the Lincolnshire Coordinating Board. Thank you, Chairman.
Thank you. Declaration of councillors' interests. If any member would like to declare an interest, can you please indicate in the chat function now by typing speak? There is something there. Is that a... I think we've had a big enough pause, so I will now move on to the minutes of the last meeting, which was held on the 29th of September 2020. This item is to confirm and sign the minutes from the last meeting of the committee on the 29th of September 2020 as a correct record. I'd like to propose the minutes as a correct record. Do I have a seconder for these minutes?
Councillor Ron Oxby, I'll second those, Chairman, if I may.
Thank you, Councillor Oxby, that's very kind of you. Right, and then going to the vote, can I do it by exception? So if anyone has a violent disagreement, would they like to type it in the chat function? Otherwise, I will take silence to mean that you all agree. Again, I don't see any. Oh, we have an abstention. Sorry, and I missed who that was.
It's me,
Rod
Councillor Kendrick. Yeah, thank you, Chairman.
Okay, thank you, Ron. Moving on then, we will go to the action updates. This report you will find on pages 13 and 14 is simply for information only. Do you agree as a board to note the action updates? Again, I will go to the majority view. If you cannot agree or wish to abstain, would you type it in the chat box now? Okay, I don't see any abstentions or disagreements at all. We'll now move on to the chairman's announcements. And I don't intend reading these out because I'm assuming that you've read everything here. And just again, they are for information only. The only thing that I would like to add, and I think that Councillor Oxby did raise it a few moments ago, is I would like to record the retirement of Brendan Hayes from LPFT, and he retires as the Chief Executive. I understand there is an interim in place at the moment, and we would like to record our thanks to Brendan and wish him a good retirement. Okay, moving on. We will now go to the first item on the agenda. This is a proposal to incorporate the functions of the anticipated Lincolnshire Integrated Care System Partnership Board. I've got the notes here that say myself and John are going to introduce this item. I'll tell you now, John's going to do most of the speaking. However, what I would like to do is just make you aware that when this paper was put together, it was prior to information being received from NHS England as to exactly what they expected to see in an integrated care system. And board at least. So I wouldn't suggest that we were slightly flying in the wind, or finger in the wind, but since the definitive guidance has come out, we are now finding that we've just got to read through it. We haven't had time. It only came out on Thursday. And so when we come to the recommendations, I'm going to ever so slightly tweak the recommendations or suggest a tweak to you, just so that that takes into account the guidance that we have now got to have a good look at. So on that note, I'm going to ask John if he would like to take over from me and just expand on this paper a little further. Thank you.
Okay, thank you, Sue, and afternoon, everyone. This paper represents, I think, a lot of really good work that the County Council and the NHS has been doing together in terms of how we work in partnership around the overall health, well-being, population health improvement agenda, and builds on, I think, a lot of good work that's already well established and ongoing in the county. The particular background to the thinking in the papers, which has slightly now not been overtaken, but we do need to reflect on in the light of the NHS England policy document which was published last Thursday, which I'll come onto in a moment. But just going back the way, in January 2019, NHS England issued a national long-term plan, and that envisaged the development of integrated care systems across all the geographies of England. There is a sort of technical designation process that the NHS is required to go through in relation to that. The discussions that we've had more recently as national policy and our thinking locally has evolved has led us to conclude that we believe an appropriate way forward for us in Lincolnshire is to pursue something I could describe as a slight variation from the national model. The national NHS model envisaged the creation of integrated care systems partnership boards with responsibility to lead and coordinate an overall health improvement effort, working with partners across not just the NHS system, but clearly local government, the voluntary sector and the third sector. The view that we have taken recently is that most of the individuals who we would want to have involved in the Integrated Care System Partnership Board are actually or could be members of the Health and Wellbeing Board, and that most of the agenda of a proposed Integrated Care System Partnership Board has a huge overlap with the work of the Health and Wellbeing Board. So to kind of cut a long story short, the commitment to joint partnership, integrated working in Lincolnshire, not just between the NHS and local government colleagues, but also with a wide range of other partners, is, I think, very strong and impressive. And we've got, I think, an ever-growing track record of improvement to the population as a result of that. We didn't see any benefit in creating a separate board in Lincolnshire to undertake work which was extremely similar to the work that the Health and Wellbeing Board could undertake. So the paper that's in front of the board this afternoon is, I think, quite an innovative suggestion that the work of the Integrated Care System Partnership Board be, and originally our thinking was incorporated within, but now, and I'll come to on a few moments, I think it needs to be aligned with the development of the Integrated Care System body. So up to about Thursday lunchtime last week, I certainly was very comfortable with the proposal as it is in front of the board this afternoon. However, on Thursday afternoon last week, NHS England issued a new policy document, which I think, Sue, if we haven't had an opportunity to bring to the attention of the Health and Wellbeing Board, it might be helpful that we do so. There is a lot in this policy document. It is called the Next Steps in Building Strong and Effective Integrated Care Systems Across England, and much of the policy is very much in line with how we've been trying to take things forward here in Lincolnshire. So strong partnerships between local government and the NHS, care homes, the voluntary sector and other partners, strong push on health inequalities, health improvement, population health management, prevention being better than cure, and all of the things we've been working on together. And the emphasis on joint working with local government is very, very strong. And I think is pretty much in line with how we had envisaged, how we are working here in Lincolnshire. However, the document also contains two options for legislative change, and the option that is clearly favoured in the document actually envisages from the 1st of April 22, so in 16 months' time, that clinical commissioning groups across England will cease to be in their current model, and that a new NHS body would be established called an Integrated Care System body. And the document describes a range of responsibilities that body would have. The document also contains quite a lot of other really important policy initiatives. So I think, Sue, where certainly I've got to, and my sense is that we, have a similar view, given that this kind of once in every 10 years type of policy document has just come out from NHS England. I think it's important that we do take the opportunity to reflect on the document and what it may mean for our ambitions here in Lincolnshire. I think the general way in which we are working is entirely consistent with this new policy document, so I don't have any concerns in relation to that. But clearly, if legislation is going to be passed next year to establish a new NHS body to replace the CCG, called an Integrated Care System body, then it's important, I think, that we do just have a bit of a step back and just think about what that means for the proposals that we've got in front of us today, what that might mean in terms of potentially alignment rather than integration of work, what it might mean for membership potentially, and the extent to which we might need to reframe the document that's in front of the Health and Wellbeing Board this afternoon. So I wonder, Sue, if I should just pause there. I realise that for the board, that is information that's relatively hot off the press just last Thursday. Certainly in the NHS, it's going to take us a little while to digest the totality of this document. Clearly, for those of us working in the CCG, it will be some structural change, potentially, not potentially, it will be again. But in terms of broad policy approach, I think the sort of renewed energy and focus on partnership working, integration, doing things together for the benefit of our population is very, very welcome, and also importantly builds on some superb joint working that we've all witnessed, I think, over the last 8 or 9 months through the pandemic so far. So I'll pause there, Sue, and obviously happy to take comments or questions. Thank you.
Thank you, John. And yes, on the point that you made about this document, I'll make sure that Alison forwards a copy to everybody at the end of this meeting. We have Councillor Nanstead, who would like to speak. You're on mute.
Oh, sorry, I'm not now. You mentioned, John's just mentioned the 1st of April 2022 as when the new body comes in. In this report, you mentioned that you have to have an overarching body in place by April 2021. Has that, the statement in paragraph 2 of this report, has that now been changed by what's said on Thursday? I'd also at some point like to make a comment about the paragraph 1.3 in the membership as proposed in this, but perhaps I ought to deal with that one first.
Okay, thank you. In terms of the, if I call it the short-term requirement, there remains still a requirement to have an ICS partnership board in place for the 1st of April 21, but very, very clearly, whatever the arrangements we put in place in the short term have to be a sensible bridge to April 22, which is why I think it would be wise for us just to take some time to think about what that might look like. So yes, and the majority of systems in England, whilst a number are already designated as integrated care systems, the majority aren't. So the majority will be looking at, so what arrangements do we need to put in place in the short term that will then take us forward to April 22. So we're not alone in Lincolnshire, very far from it, in just having to work our way through this particular dynamic.
It might be better if both dates were the same, would it?
I couldn't possibly comment, but perhaps just to say that the April 22 date is of course subject to legislation passing obviously through Parliament, and clearly that will take an amount of time for the government to attend to.
Yeah, okay, thank you. I just add on paragraph 1.3, I will be against that.
I think also, Councillor Nanstead, that there is an opportunity for us, as you've heard me say countless times before, I don't mind what we do as long as it works for Lincolnshire. And when we have guidance like this, to give us a 12-month run-in, if you like, or lead-in time where we can work effectively in shadow form, we can either iron out the bumps and or we can decide it works really well or it doesn't, and we can present the way it works for Lincolnshire to our colleagues in the NHS and say, well, this is the way the system is working in Lincolnshire. If you want to pull it to bits or stop us from working that way, on your head be it. So you know, there are pros and cons in both dates, let's say. Councillor Bradwell.
Yes, thank you, Chairman. Just quickly, I have to say I agree with yourselves. It's just typical. I'm going to get at the government now. It's just typical, isn't it? They give us a paper and you get all ready to think you've got the situation perhaps moving forward to where you want it to be, and it all changes again. So that's no surprise. But I do think it would be helpful to pause, because we do need to get it right. We don't want to set some system up and then have to find we've got to backtrack. So I think the suggestion that you and John's made is very sensible, and actually, you know, having that bit more time, you know, will only be helpful. I mean, to be honest, even if you hadn't had the change, there's all sorts of other things happening at the moment. I know we've got to press ahead and make decisions, but you know, other people who might be around the table might be too busy, if you get what I mean. So I just think we just need to do as you suggest, and I don't think it will put us back in any way, because we do have strong working relationships with our NHS colleagues and partners as well, who work alongside us. We all do work together very well. So I think, you know, in the end, it might be a good thing that it's given us a bit more time to think about how we do things in the future.
And just to elaborate on that a little more, although we'll wait until we come to the recommendations, Alison has, and Alison, please don't be afraid to come in here and just correct me if I'm wrong, but by having this a little bit more time to look at what the guidance says, we could then have the opportunity for an extraordinary meeting at a later stage in perhaps February, and we would then still have the time that the NHS needs, or our health colleagues need, to have something in place for them to adhere to their tick in the box, as it were, and that should all still fit in. But from now until February would probably be a good idea. Alison, is that about right?
Yes, Chairman. I think I'm going to be working with a colleague from the CCG side to look at the detail and come together, pull together some more detailed proposals and terms of reference. So I think if we could do that work between now and sort of the beginning of February, that would be helpful. So we can then table something at an extraordinary meeting in early next year, so that we can have that time to then put things in place for our meeting in March. That's at the end of March. So yeah.
Thank you. Okay, Councillor Kendrick.
Thank you, Chairman. It's probably too soon to ask this question in view of what John's just said about the changes that have come down the line on Thursday. And like Councillor Bradwell, it's no surprise to me that these things keep changing. But what I was going to ask was, looking at the proposals for the new board, I think bearing in mind the changes that may come down the road, that there'll still be a rep from the voluntary and community sector. And I was just wondering how that might be determined. I know from experience there are a number of forums around the county with voluntary groups having membership of them. I used to go to them myself at one time, and I was just wondering whether they will be invited to nominate somebody, or I was just wondering the mechanics of it. As I say, it's probably a bit too soon to ask that question, but I thought I would. Thank you, Chairman.
Okay, John, would you like to answer that, or shall we do it between us?
Well, I think it's fair to say, Sue, that we haven't had a detailed discussion about that precisely. I think it's important to say, and I'm just looking it up, that the voluntary sector is also signalled in this new document as being a key part of this. That's very welcome. There is an arrangement called the Voluntary Engagement Team now that is developed in the county, that Glenn Garrett and I have had a particular interest in supporting. That would be where my mind would initially turn to in terms of the conversation for how that representative could come forward. But we haven't, have we, Sue, had that level of detailed discussion so far?
No, we haven't. But it's on the to-do list. Hugo.
Hello, and apologies for being late. I've been on the NHS volunteer run, which is why I'm late. But and actually, it's quite interesting because yesterday there was a big article in the Sun newspaper, both pages, because Jeremy Clarkson's got behind the Royal Voluntary Association, along with Amanda Holden and the Archbishop of Canterbury, all on the drive. And actually, ironically, the guy that I do the work for was actually a feature of it, and Clarkson had rung him up and all went on. And in fact, everyone got a mention except for the poor person, the volunteer, which was me. But and so they are doing a big drive, and that's the Royal Voluntary Services, which I think's the key driver behind the NHS one. Yes. But I mean, my views on it are it's okay, but actually it needs streamlining a bit, because I'd come off it because in the end my phone was just going all the time and you were ringing people up. They didn't need anything, but then because you rang them, you then got caught up in a 10-20 minute conversation to deal with their loneliness. And I'm like, well, actually, I've got to work as well. And actually, you don't mind doing it when it's needed, but I can't quite give my time up all the time. But it's all good. And I think, you know, you get highlights like that and it'll hopefully encourage others to sort of follow up and pick up the piece and go with it. So anyway, that's why I'm late, and apologies, and that's my bit on the voluntary bit. So
Okay, thank you, Hugo. Yes, I too am a Royal Voluntary Service NHS responder, and all I'm interested in is making sure that cohort is working seamlessly with all the other voluntary services that are roundabout on the footprint, because I think that's the issue. It's making sure that we spread that jam as thinly as possible. Councillor Worth.
Thank you, Sue. John, I don't know whether this indicates a subtle change of direction with this integrated care system board as regards kind of longer term planning. So where we do things like joint strategic needs assessments, that type of thing. Also, you know, maybe focusing a different focus maybe on budgets. I don't know, just a kind of view as to whether you think this is a kind of subtle change in the way NHS are thinking.
Thanks, Nick. I think it's a very clear shift in explicit national direction from the NHS, one which is absolutely into the space of integration, partnership working, and local areas having a degree of flexibility to work out how they can best work together, not just local government and the NHS, but also all of our other partners, the voluntary sector, the care homes, police, and so on, in terms of how best to improve the overall health of the population and to reduce health inequalities. So I think it is a very clear signal in terms of this is now the way forward for the NHS. I think we in Lincolnshire, we've done a pretty good job in working in that fashion anyway over the past few years, and increasingly so through COVID. It's interesting that the option to create an NHS statutory body describes how the current CCG arrangements, where the CCG is a membership organisation, all of that, and the members are the GP practices, all of that will cease, and that this new ICS body would have a board consisting, and I quote directly, of representatives from the system partners. As a minimum, it would include representatives of NHS providers, primary care and local governments, alongside a chair, a chief executive and a chief financial officer. So that very clearly, and I think to my mind, it's very welcome, explicitly is seeking a local government representative on this new NHS body. I think it's a shift in that direction, which I would welcome. I think the other point, Nick, is that clearly, given the economic circumstances of the country in the years ahead, it clearly is our responsibility in Lincolnshire, isn't it, to make sure that the totality of the taxpayers' resources that are invested in our public services are used to maximum possible effect, because we know that it's unlikely, my sense would be, that once we're through the pandemic, there will be much additional public funding available. So again, I think that when it comes to things like how we use our estate, how we join up services, how we work with partners differently, it will all be with a view to maximising the investment that the public make in services we're responsible for. Thank you.
Thank you, John. I don't see any more speakers, so I would therefore like to go to the actions required. And as I say, if I could now just advise members that we keep A, as it is, that we note the content of the report, B, that we confirm it supports the proposal to align the functions of the anticipated ICS PB with the Health and Wellbeing Board. Sorry, is somebody wanting to speak? Sorry, I'm not sure if oh, no, I do beg your pardon. I thought I heard somebody asking to speak there. That C, that we keep as it is, that we agree to officers developing revised terms of reference, etc. And that D, we consider and comment on the membership as set out in 1.3. And I would then like to invite you all, if you have thoughts on the membership in the meantime, to then feed them through to Alison, and then we can continue to work on what we bring back to the extraordinary meeting February time. Thank you very much indeed, everyone. Thanks for the can we now move to the vote? Again, I will do it by exception. Is there
Excuse
anyone?
Excuse me, Chairman. If you're proposing that, you need a seconder.
Oh, I do. Oh, damn! I can't rule the world.
Happy
Okay.
to second that, Chairman.
Thank you
I'm happy to second.
Thank you, Nick. Thank you, Katrina. Vote by exception. Then, if you disagree, can you make yourself known, or you wish to abstain in the chat function now?
Can you just confirm about D, that you were not actually agreeing the membership today?
That's exactly it, Councillor.
Yeah, that's fine. I'm okay then, yeah.
We are merely noting it, and in other words, now we've had that piece of document, or that document rather, that we're going to take it away and then work it up. At the time of writing this paper, that document wasn't available. So yes, D will be just to, as I say, consider and comment on.
Right,
So,
okay, I'm fine then. Yeah.
So moving to the vote, as I say, any abstentions or against, please put in the chat function. And I don't see any, so I suggest that that has been carried. We now move on to the following agenda item, which is item 6B, which is the Lincolnshire Home for Independence Blueprint. I'd like to, in a moment, invite Councillor Wendy Bowkett, Chairman of the Housing Health Delivery Group, and Sem Neal, Assistant Director of Prevention and Early Intervention in Public Health, to present this report on pages 23 to 60 of the report pack. I'd like to also take the opportunity to thank them so much for the work that they put into this piece of, into this document. As you all know, housing and health is one of our priorities under the Health and Wellbeing Board, and this document has not only incorporated and had the buy-in from all of the districts, the areas, our health colleagues, county council. It really is a team effort, and it's only down to the hard work of Councillor Bowkett and Samantha Neal and her team. So over to you, Wendy.
Thank you, Sue. Well, I'll just give you a quick summary of it, and then Sam will come in with any things that I've missed, if that's okay. Yep. So, as you just said, it's the Lincolnshire Homes for Independence Blueprint for Housing Healthcare Delivery Group, and seeks to provide a high-level vision for the provision of greater range of housing options for those that need additional support, which we know is greatly needed, and better integrated options for those that need additional support and better services to promote and sustain independent living. It's taken a while to get here, I will admit. With COVID, it hasn't helped. We had our first workshop last January, and since then, it has been hard work to get here. But now the blueprint has been endorsed by the CCG, and by yourself, Sue, and by myself as Chair of Health, Housing Care Delivery. There is a focus in independent living throughout our life, no matter what age, giving people choices on housing options. One option is the obvious one, keeping people at home for as long as they want. And so the concept of home for life is so important. Whilst older people are the largest cohort of people with needs, there are others with particular needs, such as disabled or the homeless, which are highlighted in the blueprint, whose ability to live independently is currently limited by a lack of appropriate housing or integrated services which are easy to navigate. The majority of the homes that people live in now may not be suitable for their needs, particularly as their needs may change over time. More can be done to provide adaptations and equipment which centre on the needs of the person. This could be done by using DFG funding. A business case is being developed to review existing services to secure better outcomes and use of resources to support the delivery of the blueprint. There is a focus on private sector housing, including supporting low-income owner-occupied households living in poor conditions or unsuitable homes. To improve or adapt them, all districts are working with partners to try and implement this. The blueprint also looks at helping people to find and move to a different home for life. New build housing design, quality and infrastructure, and accessibility standards are included in the paper, linking to the work of the Housing Infrastructure Group on the Lincolnshire Design Guide Review Panel. Government, as we all know, is at present consulting on a planning for the future. A white paper on proposals for reform of the planning system in England and accessibility standards in building regulations for new homes. Should a standard similar to lifetime homes be enshrined in building regulations, it would embed the principle of housing for life. Health Housing Care Delivery Group have responded to government consultation with the changes that are needed to make this happen. Developing this blueprint is a first step to agreeing across local government, social housing providers, district councils, health, the ageing better, the standards which we wish to achieve in Lincolnshire. The outline of the Health and Housing Care Delivery Group delivery plan identifies actions completed and potential new actions to achieve the delivery objectives set out in this blueprint and will remain as an up-to-date work plan. We look forward to working together with all partners to deliver more flexible contemporary housing and supporting all our residents with a forever home. Finally, can I thank Sam Neal, Sean Johnson and Lisa Law for all their hard work that they have helped in putting this plan together, and the partners that sit around our table for all their contributions, which we wouldn't have got here without them. So if I can just pass over to Sam quickly and ask her to bring in anything that I have missed, which I'm sure there's loads.
Very little, actually, Councillor Bowkett. I think just to reiterate the point about membership, and it links back to the previous item that was just discussed. I think some time ago, when the Housing, Health and Care Delivery Group started, we put together a memorandum of understanding, and that brought the first group of organisations around the table. That group itself has been on a journey over the last couple of years. We now have really good membership and attendance from the CCG and our health colleagues. And we have elected member engagement from all of the 7 district councils. And those two things in themselves have changed the dynamics and very welcome from an officer point of view in terms of being able to get a really clear steer in terms of delivering actions. And I think we can be quite ambitious about this plan, certainly in terms of the wider context that John's just been describing. But the time is now really to start to put some of this into action and move from what we have had as clearly very, very firm commitments to turn this into a delivery plan. So the delivery plan that's in front of you is clearly not yet completed. All the actions that we need to take forward are there. But where we are currently is making sure that we have this call to action at the centre of people's agenda. I appreciate that everybody's resources are tight at the moment because of COVID response, but there is a part for every organisation in this meeting today to play a part and to play the most appropriate part to turn that into action. So I think the only other thing to say is that when you next see this document, it may look slightly different. The only thing at the moment, subject to any further comment at the Housing, Health and Care Delivery Group next week, that we plan to change is the graphics and the format, which still need a little bit of work. The intention is not to publish this as a glossy brochure, and it's also not intended, particularly at this stage, to be an outward-facing document, but it is intended to share with our staff across our organisations. And that's the reason for the 2 recommendations today are to endorse this as a final draft, but also to become champions of this in your own organisations. And I think what we have realised as a group taking this forward is that there are very few areas of our work that housing doesn't feature in at some point, because essentially it's about people and how they interact with their environment rather than the housing itself necessarily that's always the issue. But I think, again, just echoing thanks to everybody that's been involved so far. I'm feeling excited and ambitious about taking it forward.
Thank you, Sen. Questions? Anybody? John, you have a question.
Thank you, Sue. No, not a question, just a comment if I could, please. I'd just like to completely endorse this. I'd like to congratulate Councillor Bowkett, Sam and the team for their leadership and work in bringing this together. This is so important, isn't it? So important for the people we serve. I'm delighted that the CCG has been an active partner in supporting this. It's right in the sweet spot of the previous item, wasn't it? Us all integrating and working together to try to deliver the best overall impact on the health of the people of the county. So I just wanted to just emphasise the CCG's support and my personal support for this. Thank you, Sue.
Thank you, John. Bill.
Thank you very much, Chair. And again, echoing John's comments there, very kind of grateful to see this blueprint coming forward. And whilst I appreciate my role on this forum is as guest, if you would indulge just 30 seconds worth of comment. Certainly, many of the points it raises are ones which the police service in Lincolnshire are equally concerned about, where we see rough sleeping, where we see the elderly or the infirm, they become vulnerable. And when they become vulnerable, they become victims more easily, and all of the attendant health problems and issues for them and for the rest of us follow in train. So to see something which is attempting to at source address those concerns and those issues is really most welcome. I would add that, as a police service, we're very much wanting to play our part in this. So whilst we're not explicitly mentioned necessarily in the document, nor do we need to be, I would definitely welcome us being involved in how the implementation of this goes forward. Sometimes I feel that issues of safety, and particularly the role that the policing can play, come as a bit of an afterthought in planning, for example. And if we're talking about this being a blueprint for the development of new sites or the refurbishment of existing sites, then an early involvement in what policing can bring to that discussion, or indeed how policing can be built into those areas, would be very welcome. We take a view here that the model of policing should be a dispersed one, not a centralised one. And if there are opportunities to build in local policing at the outset of any kind of initiative or investment, then that would be really, really helpful. And clearly, we'd want to do what we can to support any access to central government grant in terms of supporting things such as initiatives around rough sleeping. So, Chair, very much welcome it and support its content, and just ask that policing is kept in mind when it goes forward.
Absolutely. Thank you, Bill. Councillor Nanstad.
Thank you, Chair. I'd support this as well. I think it's a very thorough document. I'd just like to make a few comments. I'm very pleased, for instance, that on page 10, I think it is, yeah, page 10, but page 38 of the agenda, there is some emphasis on the size and layout of homes, because one of the issues in recent years in this country has been the construction of homes which are actually quite small. Small homes tend to affect people's mental health because they haven't got the space around them that they need. And that is really quite an important point. And the other thing is about sustainability and the need for the future, and the fact that things will be changing, regulations will change, and we need, people need to keep on top of that. There are actually some very good examples around the country of sustainable and well-designed local authority and social housing schemes. I can think of the Joseph Rowntree Trust scheme at New Earswick at York, which is a very good scheme, and the Goldsmith Street scheme at Norwich, which won the Sterling Prize in 2019, which I think is the first time any social housing project has won that. So there are some very good examples if people need to be signposted to them. Thank you.
Thank you, Donald. Right, I've got a bit of a problem now because there is a Councillor R that wants to speak, and I don't know whether it's Ron or whether it's...
It's Councillor Roxby, Chair.
It is it? Yeah. Oh, he's only coming up as Councillor R, so trying to outfox us, are you, Councillor Roxby?
Thank you. I thought you was forgetting me, Chairman. Yeah, I read this with a great lot of interest because I don't know if Glenn Garrett's still with us, but 5 or 6 years ago, I did him a piece of work due to the fact that I have a property maintenance company, and I put prices together that would sort of make comparisons with standard builds as we're using today and adaptive builds, which we could actually build as we build in these new properties, i.e. wider doors, wider hallways, and windows that were deeper, so that people, for argument's sake, if they ended up in a wheelchair, could actually get to them, and also lower handles. And I have a feeling that Glenn was going to a seminar somewhere to present this. I think that's why I did it some time ago. And basically, it worked out as cost neutral. The fact that you put a larger window in costs more money, but of course you're saving bricks and block works lower down. So again, it's a situation where, as we're building today, these could be adapted, or shall I say, designed with the future in in the pipeline already. And I think it would be a very simple job to do, and I think we could actually lead the way here and suggest these. We've got some very good district councillors, councils I should say, that have very good planning officers there that could put these proposals forward. And I think it's been a long time coming, but I think it's been well worth the wait. Thank you.
Thank you, Ron. Any other comments? I remember Ron saying about explaining about this business of the build and size-wise and everything, and it just seems so simple, but hopefully, as he says, long time coming, but maybe we can get it off the ground at some point. Any other comments at all? Well, in that case, again, if I could thank both Wendy and indeed Sem, and if I ask members now, if we go to the actions required, which are shown on page 24, that we endorse the Lincolnshire Homes for Independence blueprint, and that we recommend that relevant partners adopt this blueprint through the appropriate decision-making process for their organisation. Can I have somebody to second that, please?
I'll second it, Councillor Woolley.
Thank you very much.
I'm very keen on it.
Thank you, Councillor Oxley. And again, we will vote by exception. If you disagree or you wish to abstain, would you put it in the chat function? Otherwise, I will assume that you are voting for. Thank you, colleagues. Okay, we now move on to agenda item 7A, which is the COVID-19 update. And I'm hoping that somewhere out there is Derek.
Hello, Councillor Woolley. Yes, I'm here.
Jolly good.
What I'll do, I'll leave plenty of time for questions, conversation. I'll do a little bit on the numbers, a little bit on the policy changes that we're experiencing at the moment, and then I'm happy to have a conversation, answer any questions I might be able to. I think it might be worth also giving John a chance to maybe give an update from the NHS side as well, if that's okay. In terms of the epidemiology, the numbers where we are now, as board members will be aware, since probably the beginning of October, we've been on a steady rise, and that accelerated through the middle of October through to about the middle of November. So probably 17th, 18th, 19th, 20th of November was when we were at the peak of our rates of infection across the county, albeit there's quite a lot of variation at a district level, as I'm sure we'll come on to discuss. It was at that point, around the 17th to the 20th of November, that the central government actually used the rates to decide on which tiers places we're going to go into as we come out of our second lockdown. So again, happy to have a conversation about that. Since about the 20th, we've seen a slow but steady reduction in our numbers across the county, albeit it's not as quick a descent as it was an ascent. And secondly, there is some variation and some bobbling around in our data at a district level and below, and I'll give a little bit more information on that in a moment. So overall, we peaked sort of second, third week of November, and we are coming down from that peak in terms of Lincolnshire, but there is some variability around that. We've got a particular issue at the moment with Boston, and Boston's figures over the past few days have been very high. I'm sure people are aware of that. We've got an incident control team meeting with District Council colleagues tomorrow, and we've been in conversation with them over the weekend and yesterday as well as today. We've done the analysis, and we think that a chunk of the increase that Boston has seen is down to two things. One is a couple of care home outbreaks, pretty significant care home outbreaks, about a week ago in Boston, that will actually drop off the figures quite soon, so that should help. And the second is a significant outbreak in a school as well. So both ends of the age spectrum potentially that could drive the figures in Boston, and the rate being higher than the rest of the county, given that Boston's population is in the region of 70,000 people. It doesn't take a huge number of positives over a short period of time to make their rate go up. So Boston have seen an increase, which is bucking the trend, but only over the last few days, and we think that'll play itself out over the next 4 to 5 days using a 7-day rolling average. So that just to say that. We know with this disease, it particularly impacts upon older people, and we know as we see increase in incidence rates in older adults, that will play through into more hospital treatment required, and that will sadly almost inevitably lead to more deaths. And we've seen that through the month, I'm afraid, with an increase in our overall death rates across the county, reflecting the increase in incidence. So that's where we are on the numbers. I'm sure we'll come on to talk about the tiering system, and happy to have that as a conversation, but we know we will be coming in out of lockdown into tier 3, and we'll be doing that at a county level. The government is committed, subject to obviously legislation being passed through the House of Parliament through the Commons today. The government have agreed to review the tiering system on the 16th, and that is in the statute. So we'll see where we are at that point. I think other key issues that are going on at the moment is that we've been working really closely as a team with the City of Lincoln and with our universities about offering testing for students who want to return home. And that is all up and running at the moment. We haven't got any figures through yet, but the health protection team went out to support the university setting those testing up. I think it's a really positive thing to do because it means that we will be testing students who don't have symptoms. And that means that we will hopefully pick up some people who may have COVID but aren't showing any symptoms, and be able to make sure that they aren't passing on that disease to others, whether it's on the journey home or whether it's when they get home. The likelihood, though, is that will result in an increase in the number of positives we get in Lincoln, because we're testing a lot more people and we're testing them asymptomatically, which is different to the normal model. We only test through the showground or through other methods where somebody's got symptoms. This is a different government policy about testing asymptomatically. So it's just to make the board aware that we're likely to see a number of cases that will pick up there, which is a good thing, but it's likely to drive Lincoln's figures a bit higher over the next week or so. So that's point 1. Point 2 is that the NHS have just instigated a similar sort of testing model for frontline staff. I'm sure John might want to speak on this, or somebody else from the NHS. Again, that's a good thing because it will mean that we can pick up people who've got the disease, who are obviously delivering care services, NHS services to at-risk people who aren't showing symptoms. But again, that's likely to result in an increase in the numbers. We'll have to see how that plays out over time. So there are a few of the key policy changes that are happening. We are working up an approach across Lincolnshire, how we will use the new testing kits. So the lateral flow devices, happy to talk about that if members of the board are interested as well. And we will be sharing that widely across the system once that's been worked up. There's a lot of central questions that we still need answering before we can get into the operational detail, but we're very confident that we'll be able to offer some targeted testing at scale in Lincolnshire, which is the approach that's come out of Liverpool. Rather than mass testing, it's about testing in very particular places or populations, but very quickly to try to get on top of any outbreaks. And we can talk about that or talk about that in a future meeting. I think, Councillor Woolley, I'll leave it there and happy to answer questions.
Thanks very much, Derek. John, is there anything that you would like to add to that from the health side of things?
Thank you, Sue. Yeah, just a few points. Firstly, clearly, all public services are under significant strain at the moment across the health and care sector in the county. I think, as the board will be aware, the NHS really is in a very, very challenged position at the moment. I must say the amount of joint integrated working that there's been with colleagues in local government, care homes, the voluntary sector, and a whole range of other partners has been truly exceptional over the course of the pandemic to date, and I know is continuing day in, day out. And the support from our partners in the Lincolnshire Resilience Forum as well is really appreciated. As I speak to you today, actually, the NHS is going through a moment of particularly difficult challenge, particularly in our hospital services. and I know there's a lot of support going in to support the service there. The NHS, of course, is keen to stress that we are open and that we are here for the people of Lincolnshire. The Health and Wellbeing Board will be aware that in the first phases of the pandemic, services were curtailed a little, and the population didn't always come forward quite understandably for healthcare at that time. So we're pushing the message that we are very much open, and clearly we think about mental health and cancer services and operations and so on. And just to emphasise that we're really pressing hard to ensure that we're able to provide the totality of care that people need under the very difficult circumstances we're working in. A few weeks ago, the NHS in the county launched a campaign called "Let's Do This Together," which was trying to advise really people how they can continue to help us to help them. And you may have seen some of the material in the public domain about that. And then just a few other final points to stress. Firstly, in terms of the flu vaccination, the level of uptake in the Lincolnshire population is currently the highest actually in the Midlands region. So that's great to see. I think a testament not just to our general practices, but to a whole team effort of trying to get the population vaccinated for flu. That's particularly important. It's always important, but that's particularly important this year. We're working really hard on making sure we have the planning arrangements in place for when the COVID vaccine or vaccines pass regulatory approval. I think we're all feeling quite encouraged by what we're seeing in the national media around that. Clearly, none of them have passed muster as yet, and we're all hoping that will that they will pass soon, which will enable us to step into the COVID vaccination programme. And clearly, care homes, health and care staff, and the over 80s are the initial cohort of people that we're looking to focus the vaccine on. And then finally, just to say again, another bit of superb joint working across the county. We have been concerned and remain concerned about the overall impact of the pandemic on the mental health of the population across Lincolnshire. Clearly, it's affected families. It's affected people's loneliness, connection, social cohesion, and all of the rest of it. And clearly, there is a concern about any ongoing and future economic downturn as well, and what that might mean for mental health in Lincolnshire. So a great effort with all partners really means that there's now a really impressive network of mental health support available in our communities and across the county, which again over the coming weeks we're just going to be giving an extra push to in terms of highlighting the availability of it to people across the county. So I'll pause there, Sue. I know that the Health and Wellbeing Board has an interest in this, so I hope that's helpful. Happy to take any comments or questions along with Derek.
Okay, thank you very much, both of you. We've got another speaker, so can I ask Wendy and then Nick Worth? Wendy.
Hang on a sec, thank you. My interest is for the flu vaccine. We've had all the messages going out. It's over the 50 pluses now that can have a flu vaccine. On the coast, we're still struggling to get the over 70s done. They have no vaccine on the coast whatsoever. So now we've got all these messages going out, which is great. You know, we need to get as many people vaccinated as possible, but our doctors just don't have any. You know, the chemists don't have any. Are we going to get any more vaccine? That's my first question. And then my second one, just quickly, is about care homes. Boris is saying, yes, all families will be able to go and see your relatives by Christmas. I have my doubts on that. I mean, I've got my local care home here in Wainfleet, who they're not even letting people in to tell them that their wives have died. You know, they wanting to do that themselves. So I've really got issues with that, and I don't know how we're going to sort of make that better, because I really do think it is a huge problem. And you are doing a terrific job. I mean, you know, under the circumstances, it is really difficult out there. But you know, I really do worry about our coast. I really do. That I know we've had, you know, we've had the rates go up. But certainly all these messages going out about 50 pluses, it's just to me, it's just daft. You know, it's just my opinion, but they need it out there. But without the vaccines, the doctor's surgeries are going to have, you know, be inundated with phone calls. It's just ridiculous. Thank you.
Thank you, Wendy. Do either of you want to make a comment on what Wendy just said, or just leave it to Derek?
If I come back on the care homes point, I'll leave John to answer on the flu vaccine, because that's NHS side of it. In terms of the care homes, Councillor Bowkett, we did, as you'll know, it's an individual care home decision based on a risk profile about whether they're going to allow visiting or not. We did have 2 weeks where the advice that I gave, along with Glenn as the DPH and the DAS for East Lindsey, was not to support visiting because the rates in East Lindsey were particularly high. We actually rescinded that advice last Friday, so that we said, again, care homes can, or we advise the care homes should allow visiting subject to the normal PPE, hands, face, space, and all the other risk-based mitigations they put in place in the east, right the way down the coast for East Lindsey. So I think that must be a particular issue with that care home, and it might be due to ongoing outbreaks. But happy to have a chat with you afterwards and see if we can unpick that a little bit more.
Thank you, Derek. John.
Yes, and on the vaccines, thanks for those comments. I will go back and double check the vaccine availability on the East Coast. There have been quite a number of vaccine supply issues, it's fair to say, over the past, quite a number of weeks now. But I know that we received quite a number into the county just last week. So I should just go and see what the situation is today out there. And you're quite right, Wendy. The flu vaccination cohort has now been opened up. It was previously 65 years plus. It's now been opened up to 50 to 64 as well, and that clearly is on the back of nationally having confidence that the supply can be in place to meet that. But I will follow up on the particular point that you raised, because clearly we need to maximise uptake, and particularly, as you say, in the over 70s. So leave that one with me, please.
Thank you, John. Nick Worth.
Yeah, thank you. I guess when the government announced a new tier system, I was caught between a rock and a hard place, really, because with my county hat on, fire and rescue are absolutely delighted, because they actually said it's far easier for them to manage when we're all in the same tier. But with where I sit in the south of the county, I do get increasingly frustrated with government when they don't seem to recognise that, while understanding Boston may be under a lot of pressure at the hospital there, Peterborough clearly isn't. And I don't know about King's Lynn, but I suspect that probably isn't too bad either. So because they're in different tiers, so one has to assume they're probably not. But I don't know. I don't know whether either Derek or John has any thoughts on how we can push that argument, because the hospital side does seem to have quite an emphasis in their thinking.
Derek, would you like to come back on that?
Yes, I've been keeping half an eye on the debate in Parliament at the moment, and when the Prime Minister opened the debate around lunchtime, I'll just read it out. He said, as we go forward, the government will look at how we can reflect as closely as possible the reality of what is happening on the ground for local people, looking at the incidence of the disease, looking at the human geography in the spread of the pandemic, and indeed the progress that areas are making in getting the virus down. We will try to be as sensitive as possible to local effort and local achievement in bringing the pandemic under control. And there is some debate about whether that will mean a lower geography. We don't know for sure, obviously. We're not even into the tiers yet before we're talking about reviewing. But we'd hope to get more information later on this week and into next week about the review on the 16th and what the criteria may be, but also the likely geography. So I guess we'll have to wait and see nationally on that one, Councillor Worth.
Okay, thank you, Derek. Bill.
Thank you, Chair. There we go. Put the camera back on. Thank you very much, Chair. And yeah, I suppose just following on the comments from Councillor Worth and the responses from Derek there. I mean, I completely agree. From a policing perspective, we've always found it easier across a force boundary, force area, if there's a clear demarcation of what the regulations are. So it makes life a bit easier for us, but appreciating it causes frustrations for different groups of communities who find themselves in low transmission areas and low infection areas, looking at facing a restriction which seems a bit unfair. But I think, Derek, you've captured it very well. That's the government position, and we'll just have to wait and find out what they say when we move forward. It's difficult to predict what the review on the 16th of December will look like for Lincolnshire. As we open this segment with, the transmission rates are kind of low, and they passed the kind of a peak, but it's a combination of factors, and again, we don't know fully what that combination will look like, but it will include things such as hospital capacity and the mortality rates as well. So I'm afraid it still is a difficult situation to predict where it will move for us. What I positively wanted to say was that the county has responded really, really well, continues to do so. So from a compliance perspective and managing public frustration, but also public expectation, it has gone really well. And this second period of national lockdown and the prospect of a tier 3 set of restrictions are still looking from a sort of safety, a public safety and a community safety perspective as being really quite positive for the area. And I think that's, I appreciate this is a public meeting and that many of the people involved in it will be involved in things such as the SEG and LRF work. But I thought it was, for the record, worth saying that is the case across the county. And the second thing I really wanted to say was picking up on John's point in terms of mental health. People will know this is an issue that I've been raising for some time, as have others. It's not I'm a lone voice in this. I'm very much part of a strong chorus of voices that are pointing out that the immediate health impacts may well be sort of outstripped by the longer term impacts on people's mental health, and that the sort of unfortunate coincidence of effects. So people's livelihoods, people's economic futures, people's educational attainment or aspirations, as well as the impact on their physical well-being, all come together, and we end up with considerable mental health issues across the county. And we are seeing some of that as a police service. We're seeing some of that manifestation already, and we pick it up through our kind of daily reports and our work. And I know that we feed them back into the integrated sort of partnership structure. My plea is that I appreciate we had really hoped at this point that the sort of hub and spoke model would be in full flow and would be able to deliver mental health interventions at a very kind of local level. COVID has obviously interfered with a lot of the plans that a lot of us had. but I would encourage this particular board, and as we move forward, as we heard at agenda item 1, the integrated care kind of services, as we move forward, that this board takes a particular interest in the mental health support and provision, and that these services, including police and others, are working very closely together to give the best possible set of both immediate and post-crisis interventions that the public can receive. So, Chair, it was just a plea that remains high on this group's agenda. Thank you.
Thank you, and I do so agree with you. Rob Kendrick.
Thank you, Chairman. I was just wondering, coming back to hospital bed or ICU occupancy, I know at the outset in the first shutdown, the big concern was the NHS being overwhelmed, and I don't think that actually occurred, and we had the Nightingale Hospital report as well. I was just wondering, I don't know if John can help us on this, what the situation is, because there have been some media reports which perhaps have been rather exaggerated, I don't know, which are saying that, we've reached crisis point at some of our hospitals in terms of bed space in ICU due to the pandemic. I don't know how close that is to the truth, or whether that's just a little bit of media hype. I just wonder what the situation was.
Okay, I mean the position today is that our hospitals are very challenged by the situation. One of the most significant contributors actually is how many staff are not able to attend work, either because they have COVID-19 or have been asked to self-isolate. In terms of the number of COVID positive patients we have in our hospital services, certainly for the past number of weeks, it has been more than double the peak of the first wave. So that's significant. As you'll have heard on the media, the management of patient care for people who've got COVID is obviously evolved quite a lot. So many more patients are able to have their care on a general medical ward rather than in intensive care. Certainly our local hospitals have what's called surge capacity available in intensive care, and that has not needed to be used in a material way so far, but this is a rapidly developing sort of situation. So it is, I don't want to leave the board in any doubt that there are significant challenges every day in our hospital services, and we're going through a particularly challenging couple of days just at the moment. I think it's also worth noting that our hospitals are not alone in terms of the staffing challenges and the impact. I think that's having an impact across the public services. I know that our community health services are caring for approximately 1,000 COVID positive patients in their own homes across the county, and I know that in our mental health services they've had to make adjustments as well to accommodate some of the reduced staffing capacity that they've had. So that's probably as much as I can say, but as I say, we are in a very serious situation here. And just going back to comment that Nick Worth, or a comment in relation to a comment from Nick, I do know that the pressures across the hospitals do sort of all hospitals are under pressure at the moment, certainly in and around Lincolnshire. Some days and weeks, some feel it more than others, but this staffing issue is clearly a concern outside Lincolnshire hospitals as well, be that Kings Lynn, Peterborough, North Links and Goole and the Nottinghamshire hospitals too. Thank you, Sue.
Thank you, John. Donald.
Thank you, Chair. First of all, it's a comment really towards John, and I endorse the comments Bill Skelly's made about mental health. I'm very pleased when you made the comment about increasing the support. But does that mean there's extra financial resources going into mental health, or is it a reorganisation of existing resources? Because it's clear that it's not just the effect of COVID that will affect people's mental health, but the potential for people to either be unsure as to whether they've got a job or whether they lose a job, and the long-term effects of that. So that's the first point. The second point is really a question for Derek. We are in a position where Lincoln is actually quite high at the moment and fairly worrying levels. And we've only just started testing the university students. So there's a potential there for Lincoln to increase significantly. But at what point do you trigger an urgent incident control team meeting? You mentioned you were going to have one in Boston, but in Lincoln potentially has an issue here through a number of factors coming together. Thank you.
Shall I pick up the mental health one, Sue, and then pass to Derek for the other one? Perhaps just to say, actually, prior to the pandemic, Lincolnshire had been successful actually winning a significant amount of mental health transformation monies into the county. It was somewhere around the 11-12 million pound mark over the next few years. So we were already receiving additional investment into mental health in the county to help expand and develop our services. That put us in good stead actually in the first wave in terms of being able to stand up additional services. So, for example, the development of the 24/7 sort of crisis support line is a great example there. More recently, we have received about just shy of £250,000 of what's called mental health winter monies to enable us to either put in place or maintain some services that otherwise we would have had to reduce over the coming months as well. So I certainly feel like we're getting some good investment into the mental health side of things, not just direct clinical services, but the broader mental health support. And you'll have also have seen, national commitments made by the government in relation to that. But what we're also keen to do, and is in place, is to build on the broader range of support that already exists in and across our communities in the county. So the helpline is able to join up people with support services that are local to them, that are run by a range of voluntary support organisations, depending on the particular needs. I think that social isolation has become quite a feature, it seems to me, for some people. So a lot of people are getting the benefit of being able to get a bit of connection through that mental health support line to local resources to try to support them. And obviously there are more bespoke services in place for families, for young people, for homeless people, as you'd expect as well. So it's actually is quite a comprehensive and impressive range, and again a joint effort with local government, with the voluntary sector and the NHS as well. Thank you, Sue. I'll pass to Derek.
Thanks, John. So, Councillor Nanstead, I think it's a good point about Lincoln. The first thing to say is that we are in daily contact with pretty well all of our districts, just so that we've got ongoing conversations between my team and district reps. So it's not the only time, it's not the case that the only time we will speak with district colleagues is when we call an ICT and an incident control team. In terms of Lincoln specifically, the rates have dropped by about 100 per 100,000 from the peak, but they've flattened out over the past 7 days. As I said, what we're seeing is a different pattern across Lincolnshire when we go below Lincolnshire level, but a general downward trend, and Lincoln is there. As you rightly point out, the testing of students may result in that going up, but it's better to test and find asymptomatic people, even if that means obviously we have to communicate to the public why we're doing that and why the rates have gone up, because we can then protect others from those individuals who've got COVID but feel absolutely fine, have no symptoms, and it's through no fault of their own that they're going about their daily business. So it's really important that we do test, and I'm comfortable we will do that over the next week, and then we will see that change over the weeks to come. We'll wait to see what the government says about testing students when they come back in to Lincoln, but as you all know, obviously as a councillor in the city, the population swells by about 20%, you know, goes up from 100,000 to nearly 120,000, and that will have an impact on the rates. The good news is that clearly in people that age, it tends to, if somebody's got the disease, not be a significant issue for them. It's about keeping them away from people who would get a worse case of the disease if we passed it on. So that's why the asymptomatic testing is going to be really positive, I think.
Yeah, I have to say, I do find the way sometimes the statistics, the data is presented is quite confusing, in not necessarily from what you're putting out, but from what is put out nationally. And it's actually quite difficult sometimes to make comparisons with previous data, but that's nothing to do with you. It's out your hands.
And that's why what we do internally and through all of our partners, we have a dedicated website that's protected, and we continually compare apples with apples. So we use a 7-day rolling average using the actual line list so that the individuals are positive, so it's the most up-to-date data we've got. And if everybody watches that, then you can actually see the trends, and we've got graphs that show the trends as well. So we've tried to make it as simple as possible, but as you'll understand, this is a disease that didn't exist this time last year in human beings. So we are, I've heard colleagues say, we're flying the plane whilst we're trying to build it as well, which is a bit tricky.
Yeah, thank you.
Thank you, Derek. And finally, Tricia. Have we got you, Trish?
Sorry.
That's all right.
Sorry. Yeah, I just want to come back on mental well-being, because I think some of it is about, especially our elderly population. Some of them have been confined to their houses now since perhaps the end of March, and not all of them have got what you would say health issues. They are isolating because they're very frightened that they don't want to catch the virus. And I think maybe maybe what we need to do is, because we've got lots of community groups still out there, and actually I know the ones in a few of my villages, I don't think they're quite as busy as they were first time around. And I don't know whether from the district councils and that we could get in contact with the community groups, because I know several of mine were ringing up people in the area, and they might still be doing that, I don't know, but I think some of it is about that isolation and not seeing anybody. And it is, and if you're not able to get out and about just for a little walk, you can understand why people then start to feel the mental health goes down a bit. Do you know what I mean? Even myself, my husband and I have been saying this time around it is much worse than it was in the springtime, because the springtime the days got longer, so you could go out and have a walk after you've had your evening meal. Now you start quite soon, and so just on that, I wonder whether there is a bit we could do with our community volunteers, make sure they're doing what they did before. And the other one was on the testing of students, but I think Derek's answered this. I think the rates will go up, like Derek has said, but I think it is that message to the media perhaps that we have probably tested, I don't know, 2,000 or 3,000 more people than we did the week before. Actually, that's, like Derek said, that's a very good thing, because these people didn't know they got the virus. But then, you know, the next week we should see it come down. But I sometimes think it is helpful to explain to the general public, if we, like when you're doing the testing at the university, we all know that that figure will go up slightly. It's bound to. So I just think, you know, that can sometimes stop people worrying, don't they? And I've had my dad on today that you'd think we're heading towards a car crash, because he's been listening to the news most of the day and reading the newspapers, and he gets really uptight and worried. So I just think those messages are good. So that's, sorry to go on.
I think you're absolutely right, Tricia, that for me, as you say, people can't, in a way, get away from it. You put the television on, and quite honestly, we've just had a patch of real doom and gloom. If it hasn't been job losses, it's been COVID, it's been all sorts of things. And so when you can't get away, and even if it's to step outside because it's so blooming cold, it's going to prey on people's minds more and more. Having said that, I think that our next group of speakers will probably have comment to make around that, because within the social prescribing arena, I think there is an element of helping those that are isolated and on their own. But if we can just finish off this item by just asking you all to note there isn't anything to vote on. Thank you very much indeed, Derek, and very many thanks to John for also filling in as well. So we'll move on to item 7B, which is the social prescribing. I'm really pleased to invite Sarah Stringer, Kirstine Redmile, and I want to have a drum roll here. I want to go, and the one and only Dr. Sunhill Indocha. It is delightful to see you, Sunhill. Seems ages ago. And for those of you that don't know, Sunhill used to be the vice chair of this particular group. So the floor is all yours, the three of you. Thank you.
Thank you. I'll leave it to the experts to give you the detail. Chair, lovely to see you. Great to be back. Fantastic forum and really good comments. I could just perhaps start with what we've heard today. What you're about to hear is some of the answers to the mental health issues that have been quite rightly raised. Lincoln has already started on the mental health transformation, and the point about delivering care in local populations is already underway. We've had a fantastic response, and thank you, Chair, and others who have been the NHS volunteers. Connecting people with social isolation has been a real good point, and so thank you for that. But you'll hear that more and more is being done in the background to connect these people. Absolutely right, social isolation has been a real issue. And I agree, mental health, not just now, but the impact of this going forward will be enormous. But just to say Lincolnshire is ahead of the game, John's right, we were really thankful and successful in bidding for additional funding. And my colleagues and I in PCNs are looking at how we serve our local populations, both not just with social prescribing, but new models of care, working with partners across the system to make sure that we get the mental health resilience and focus on mental health rather than necessarily on the mental illness side of it. So that's going to be crucial going forward. Just as a background, all primary care networks came into being July 1st, 2019. One of the roles they said that we ought to have were social prescribers. So every one of us has access to social prescribing across the county. In addition, you'll hear about mental health social prescribing, which is now getting going in Lincolnshire as a whole. This is additional to the other things that we're doing, and also connecting up with our voluntary sector partners just to try and build that level of resilience. So hopefully you'll hear the start of the journey as we start to come out of this particular period of time, which has been tricky to say the least. And my final point is slightly off track, but I'll echo what John and Derek have said. In primary care first wave, we didn't see that much COVID. 2 weeks ago, through the practice, we had a minimum of 3 people come to the practice admitted as emergencies with very, very low levels of oxygen. So it is out and about much, much more than we saw in the first wave. So anything we could do to support trying to contain it is welcome. And the vaccines, well, we're all gearing up to try and do our part in delivering it as soon as we get it, and that planning is underway. So, Kirsty, Sarah, do you want to just run through the paper?
Yes, thank you. I'm going to start. So, thank you for inviting us today. You did receive a paper back in March around social prescribing, which unfortunately, due to circumstances, we weren't able to present to you. But I suppose just reflecting back on what the paper said there, one of the recommendations we were looking for at that point was to be able to have a strategic discussion sort of across the health and care system around social prescribing and how we needed to position social prescribing or community connections in Lincolnshire as a real driving force in terms of supporting people who don't require a medical intervention. I think the interesting thing, the evidence base around social prescribing is developing year on year, and we know 25% of GP time is with people who have non-medical issues and requirements, and actually could be managed in a very different way through non-medical interventions. Social prescribing, for those of you that aren't familiar with the terminology, it recognises that people's health and well-being is primarily determined by a range of social, economic, environmental factors. And we need to be thinking about how do we support people differently to be able to connect or reconnect back into their communities and look at different opportunities and different ways to support their health and well-being. And it's really pertinent. All of the conversations and discussions this afternoon really play into the social prescribing arena in terms of integrated community system, because that's absolutely what this is about. This is about workforce and people across health and care working together and working with people in terms of being able to access support and services in a very different way, and also in terms of mental health. Absolutely, the social prescribing agenda is around supporting people across the system with physical, mental health issues, and at that sort of lower level, and really focusing as well on prevention as well. So how do we actually enable people to access community services in a different way that enables them and stops them from actually going into crisis and into requiring those more expensive sort of statutory health and care services. So just to take you through the paper, I'll do the top bit really, and Sarah will pick up the aspect around our sort of ambition and some of the risks that we currently have, because that's part of what we want to talk to you about today. So the Health and Wellbeing Board, you may not remember, actually funded the start of social prescribing in Lincolnshire back in 2017 with a proof of concept. And we worked with our 2 voluntary sector infrastructure organisations to start recruiting 2 social prescribing link workers, and they managed to get to a place where we had around 27 link workers in post by March of this year. From a funding perspective, the Health and Wellbeing funding supported us for the first 18 months. We then accessed some CCG and Better Care funding to get us to sort of March 2020, where primary care networks and Sarah talked to you a little bit more around the Rolls reimbursement scheme, which is some additional funding that's come down through NHS England into primary care networks to fund a number of posts, which, as Sunil mentions, social prescribing link workers is one of them. So as Sunil mentioned, across our county, we have primary care networks that have access to social prescribing link workers that are predominantly employed and recruited by our infrastructure VCSE organisations. We also, as part of the community mental health transformation work, have recruited to 8 mental health social prescribing link workers that are supporting in the 4 pilot areas or areas that we have up and running across Lincolnshire, with an intention to recruit to another 10 over the next 18 months around mental health. I think it's worth noting, in terms of the model that we're looking at around social prescribing and the offer, there's three elements really, three levels. First level is around information, advice and guidance, and we're working really closely with Connect to Support Lincolnshire in terms of what that platform can do around being able to offer that information, advice and guidance. And actually that's everybody's responsibility. And then level 2 and level 3 is where you start to see link workers coming in. And that's around facilitated conversations and discussions with people around how they may be able to support themselves, or supported participation, actually supporting and working with somebody to go to a community group, to go to an art group, whatever it might be, to help them to build their confidence and motivation. Now, clearly when COVID struck, social prescribing had to have a bit of a rethink in terms of how that was going to work. There was national guidance that came out from NHS England that all social prescribing link workers should be supporting patients or people that are shielding. And over that time, we had we've had over 1,700 referrals into social prescribing since the beginning of the year, and 24,000 activities and contacts, and a lot of that has been through welfare check-in calls with people. The other thing that we managed to do is to expedite some work that we were looking at anyway, which was a digital solution, and developing a platform to enable people to connect digitally and virtually, but also to really help self-care and self-manage in terms of some of their health and wellbeing indicators as well. So the platform enables those people that have been who are accessing social prescribing to be able to use that platform, and it enables them to connect virtually with their link workers. And that's something that we've managed to bring in during the last 6 months, and that was co-produced by people with lived experience. In the annex paper there is some information around the platform and a short video as well, which people may have accessed, just to give you some information about the platform. I think the thing to note is that social prescribing is now has now got a significantly high profile from an NHS point of view. It's one of the key components of universal personalised care model. It is a partial requirement this year as part of the primary care network contract, and we're expecting it to be fully embedded into the primary care network contract next year. There are some significant implications or expectations on social prescribing from an NHS point of view. However, I think from my perspective, I'm sure colleagues around on the call today, we recognise that this isn't a new concept. This isn't something that the NHS has suddenly invented. Actually, there's been a significant amount of work going on in this space for a number of years, particularly through local government and also our voluntary and third sector organisations. And one of the ambitions that we're looking for is how we join some of this up. So a lot of the conversation today around joining up, particularly linking into commission service and voluntary sector organisations, absolutely imperative in terms of how we work together in the future. And I think it's also, as I say, a perfect example of an ICS workforce and how we work together. You know, this is absolutely about working with clinical and non-clinical workforce, third sector, voluntary sector organisations, you know, local authority, district councils, but we need to do it together, and we need to really think about how we own this as a health and care system. I'll hand over to Sarah, who will give you a bit of an update in terms of the sort of primary care network world, and some of the risks that we're currently dealing with at the moment, and some support that we need from you.
Thank you, Sarah. Okay, thank you, Kirsteen. Yes, yeah, as Kirsteen described, this is very much a national ambition now, and as we quite rightly kind of had the foresight to start this with the Health and Wellbeing Board funding many years ago, that it's now become absolutely part of mainstream expectations for NHS England to expect this from our primary care networks, but across our entire stakeholders. So we wanted to just reinforce the point, though, that this is absolutely more
more than just about the actual recruitment of social prescribing link workers. So the primary care networks have all afforded some ability to draw down on national funding for what's called the Additional Roles Reimbursement Scheme, where there are 11 different roles presently. There will be more in the future, where they can make some decisions and choose which of those roles they want to draw down funding for. And a social prescribing link worker is one of those roles, with some associated roles of health and wellbeing coaches and care coordinators, who NHS England expect to work in a triad kind of relationship between themselves to work and endorse and move on from what would be the existing social prescribing workforce that we already had. So yes, that as Sola has described, all of our PCNs have drawn down the funding for those roles. The reimbursement funding itself, though, does provide some constraints, though, because it is only available on an annual recurring basis. So it's very difficult for us to strategically plan into the longer term our ambition for social prescribing. Many of the other roles are embedded elsewhere within the system. So if I take occupational therapists as an example, there are obviously, as you're more than well aware, occupational therapists in many of the organisations. They don't just exist through this additional roles funding, whereas social prescribers are solely funded through this fund. So there is an element of competition between those different roles about the value of those roles between PCNs, and also a coordination aspect between 14 PCNs if we wanted to bring them together into a county-wide model, such as the one that we currently have in place with VCS and LCVS. So our current arrangements are slightly precarious in the sense that we don't quite have that stability and security that we would like to afford into the model. We'd like to be able to have what we've described as a greater ambition to knit together more of the voluntary sector organisations, to expand out across organisations, and to also have posts where we can have more dedicated and targeted posts, which are looking at, as Kirsten's described, we already have this for mental health, but there are many other groups of people who would be able to benefit from social prescribing that we could look at in a targeted way. And it's our belief that PCNs actually would be really appreciative of having that kind of wider net and ability to have more people brought into social prescribing if we bring together many of our pre-commissioned services and identify them actually as social prescribing, and make this part and parcel of our local strategy and ambition that we endorse social prescribing. So we've put in there some ideas around coordination with VET as a possibility, if the voluntary executive team would be able to look at that as an approach, and also for us to reconsider and hopefully get the board's endorsement about what we've already heard through the benefits of the programme seen to date through the proof of concept, but also the additional challenges that we've seen through the COVID period and the absolute appetite that NHS, strategic leaders have, but also locally, about how we pull this together and give it its sort of deserved place in terms of a mainstream funded service. So we're looking today really just to try and get the board's view really on that, about how we go about that with getting each of our partner organisations together to actually bring that together, so we remove just that reliance just on that pure PCN additional roles funding for the service. Thank you.
Thank you, Sarah. Okay, comments or questions from anyone at all? I think probably for me, the one thing that, and I'm not sure if Sem's still on the line, but I was just thinking, we'd had a conversation the other day. We have, between health and social care, we have an awful lot of overlap and an awful lot of commonality, let's call it. And I think that what we've got to be careful of is that we're not doing the same thing twice, because those voluntary community organisations are already out there. We really need to be working towards one repository, or whatever you want to call it, for all of our information so that any of us can go to it through either Connect to Support or to a funding portal or whatever it might be, because a great believer in the Lincolnshire pound and making sure that we keep it within Lincolnshire. But I would also say to you that the other issue that I'm always very mindful of is most of the little tiny organisations in this county, which you probably will never hear of, they're all doing good work, but under the radar. If we go to our, what I would call our usual suspects, it's really easy to work with big organisations because they're big, but where you get that local buy-in and local flavour and local quality is right at the grassroots. And so through our social prescribers and indeed through our own officers, we've got to make sure that we're working together on this. So right, okay, I think I've got a question coming up. I don't know why, I don't know about everybody else, my machinery is so slow. Rob Kendrick.
Chairman, I have to say this is music to my ears. As some may know, I ran volunteer support services for LPFP for many, many years, and I know the value of such services to service users. The feedback was always very positive, and also for the people who delivered the services, the volunteers themselves. I'd also endorse the chairman's comments as regards the smaller groups. And reducing duplication. I recall many years ago, I drew up a directory of voluntary organisations in South Lincolnshire, because that's where I was based at the time, so that staff, colleagues, community nurses and so on could access that and signpost people. And that was pre-digital age. Now we're in the digital age. I'm sure we could have a county-wide database with all this information available to people. I know the voluntary fora do it, such as CVS and so on. But I think this is a fantastic scheme, and I think it's great that so many people can benefit. And it has been said, so many issues arise from social isolation and loneliness, which exacerbates people's problems. I think it's absolutely brilliant. I'm all for it, Chairman. Thank you very much.
Thank you, Rob. Yes, I agree with you that the principle, it's so sound, isn't it? It's so just that interaction with residents and people. You don't have to go to the doctor because you're poorly. You know, it's just that making sure that there's somebody there sometimes, either to go and get some information from, or indeed just to point you in the right direction. Is there someone else that is? No, I think that, okay, any more questions at the moment? Don't think there are. Okay, well, thank you all of you for attending and giving your report. There's quite a tome here as far as the action is required. Can I just assume that members of the board have read it, that the actions are between pages 61 to 73, and that we all accept actions 1 to 4. Katrina, do I need a seconder if I propose?
I think these are just for noting anyway, Chairman, aren't they?
Thank you. Right. Well, in that case, can I assume that everybody notes them and that we then thank everyone for your attendance? Thank you very much for the information. Yes, you go.
Can I just speak on the forward plan, please?
You can. We're nearly there. Can I just get rid of item 8 and then we're 2 behind. Thanks very much. Lovely to see you, Sunil. Bye-bye.
Bye.
See you soon. Okay. Item 8A is an action of the previous decisions, and I'm assuming that you're all happy to note that. And then item B is the forward plan. So Hugo, what did you want to bring forward?
The other day I received, and I suspect you did as well, a letter from Robert Jenrick. And in the letter, it's explaining what the views are of the government. And one of the key things in it is they've got this 100 billion to spend in public sector infrastructure with an emphasis on hospitals. And I know from our NHS, we really do need an injection. And I think, you know, there is an opportunity here for us to potentially attract some of this funding. I mean, I think Skegness could do with a new style hospital to cope with seasonal fluctuations and align to with Boston as well. When I look at all of our sites in Lincolnshire, there is excess areas in some and Victorian workhouses in other, etc., etc. And I think that in some sense, we all been screaming out for this. And if we sit back and do nothing, we will lose the opportunity. Who takes this agenda forward? My worry about our NHS in Lincolnshire is that, and best will in the world, we are quite stable at the minute. But my God, if you look back over the last 10 years, the amount of chief execs that we have gone through in the Lincoln NHS Trust, which involves a lot of our cottage hospitals, we won't get enough stability to drive this agenda forward, going on our past record. And in some sense, I think there is an opportunity maybe that we actually try and combine forces with the CCGs, with LCC and the NHS to see if we really can't get something quite special for Lincolnshire. It is once in a, as Robert Jenrick said, a lifetime opportunity. And unless we all team together, I think we will miss this opportunity. There are other funds like the, what do they call it? The UK Shared Prosperity Fund, which is coastal. But I think if the one thing we've learned about highways in the end is that sometimes having projects ready to run, we grab a slice of the cake and punch well above our weight in Lincolnshire. And I actually think that this is the classic case for us with the NHS here. And I think that we should set the ball rolling. And I think this is the forum to do it. And I know we have an election coming up in time as well. But I think if we start the ball rolling to really, you know, the NHS has done all the work behind the scenes as well with the sort of, oh God, what have we got it called now? I'm not quite sure, but i.e. all the sort of, all the public consultation, all the work that's been going on in the background in the last 7 years or so that we've been all working towards something. Now must be the time that we perhaps bring it into a forecourt and try and somehow wrestle to get some funding. I mean, I'm all open, but it just, I think this is the forum myself. And John, CCGs and all of that, we need weight behind it and support behind it. And I think it would be maybe that the time is now, before every other vulture gets their hands on the money.
Well, I suppose, Hugo, I mean, I'm certainly not going to say, oh, but hang on a minute. But because, yeah, you're absolutely right. If you don't ask, you don't get. But I have to say that actually government has been exceedingly generous to Lincolnshire from the NHS's point of view in that writing off the ULHT monies, etc. And I'm sure John would go into more detail. But yes, you're right that if our smaller little, what I would call cottage hospitals are due for a refurb, there's no harm in asking. John, over to you. You can have the difficult question.
Well, I'm not sure I've seen the letter, Hugo, so I'm very happy to receive it. But in general terms, we are in very, very regular conversation with NHS England. There's a lot of capital that's been announced for the NHS over the past year or so, really. You'll recall that the Prime Minister was in Pilgrim, I think in December last year, announcing additional resources for the A&E services there. We do have a capital and estates plan for the NHS, and it runs into hundreds of millions. You'll be aware that that's just in the county. you'll be aware that nationally they're driving forward these 40 new hospitals. So I'd need to actually kind of see the correspondence, Hugo, to determine the extent to which it's an announcement of new money or just a description of money that's already been made, highlighted, being made available. Obviously, I think it's the NHS's responsibility to try to secure capital funding, and we've done not bad recently, I must say. For example, just recently we heard that we're getting additional capital in to help with the mental health dormitory issue in the county. So we're doing quite well. We can always do more, but I think going back to where we started the meeting, I think in the integrated care frame, we are all interested in securing as much additional public sector capital into the county as we possibly can, and I'm very happy to come back to this one maybe soon in terms of what the NHS is being up to and what our capital ask is and how successful we've been so far. But certainly in the last 9 months, 12 months or so, we've secured much more capital than we had certainly in my previous few years here.
Yeah.
Hopefully that gives you a little bit of reassurance, Hugo. But yes, thank you, John. We'd appreciate a bit of an update. That would be helpful. Can I just bring forward then the last item under the forward plan, and that is, as we mentioned right at the beginning of this, that if we at some point, and if you will allow me that little bit of flexibility, that we will bring forward in February, end of January, February time, together with John, a proposal at an extraordinary meeting around the next steps forward with the Health and Wellbeing Board and ICS. And I hope that that's okay as far as you're concerned. And that is the end of the meeting. Thank you, everyone. Thank you for your attendance, and look forward to seeing you sometime after Christmas. I hope you have a lovely Christmas. It's going to be a different one, but I hope you have as good a one as you possibly can, and that in the near future we are actually allowed outside and can socialise and just speak face to face. Do take care. Bye-bye.